Hi, how are you? I hope you're having a great day. It's a new year, and today I'd like to take a look back at what we've learned about fibromyalgia this past year, nociplastic pain, overlapping conditions, microbiome, antibodies, and more. Fibromyalgia is known as a chronic, widespread pain and fatigue syndrome that is characterized by stiffness in the joints and muscles and tenderness throughout the body. Symptoms may come and go, and flares are common. Our muscles may twitch and spasm, and about 4 million people in the US live with fibromyalgia. More women than men appear to be afflicted. Digestive problems are common. Brain fog, anxiety, depression, and sleep issues are also common. We've learned that fibromyalgia is now classified as a nociplastic primary pain disorder. There are two other classifications that do not include fibromyalgia. They're called neuroplastic and nociceptive pain descriptors. Nociplastic, however, in fibromyalgia pain, appears to be due to inflammation and damaged tissues. There's also altered nociception, a change in how we perceive pain. Due to the activation of peripheral nociceptors, which are sensory neurons that extend into the nervous system outside of our brain. Fibro is a neurobiological disease that affects our sensory processing system. It's believed that we can change our brain processes by trying a number of different tactics like soft touch, warm baths, gentle movements, imagery, and using calming scents. This makes sense, except that there are other overlapping conditions that can make living with fibro more difficult. And let me include, one study found that about 30% of us with fibro have a positive ANA test, and 75% of those have the speckled pattern. Hashimoto's disease has been found in about 30 to 40% of fibromyalgia patients, and about 44% with hypothyroidism. This is a progressive disease, so getting it under control is necessary. Autoimmunity is often found in fibromyalgia. This has been known for quite some time, so it's not a new thing. 40 to 65% of those with lupus also have fibromyalgia. And 57% with RA, 24% with psoriatic arthritis, 30% with Raynaud's phenomenon, and 18% with Sjogren's syndrome also have fibromyalgia. And then in the autoimmune thyroid disease, 31% have fibromyalgia. Recently, small fiber neuropathy has been found in 40 to 50% of fibromyalgia patients. Muscle cramps, dry eyes, orthostasis, and gastrointestinal dysfunction are common. Genes are known to play a role in determining our pain sensitivity and response to pain. However, the degeneration of small nerve fibers has brought attention to the possibility of autoimmunity in fibromyalgia. Autoantibodies are present in small fiber neuropathy, a neuropathic pain disorder, And these researchers believe that small fiber pathology or small fiber damage is a potential contributor to the dermal skin innervation that is found in fibromyalgia, meaning we have impaired thermal tolerance. It's also believed that something systemic is causing nerve problems in fibromyalgia, and that something is probably the immune system. Another interesting fact is the microbiome aspect of disease. It includes bacteria, fungi, viruses, and cells. It includes your mouth down to your intestines and everywhere in between, where all those little critters live, trillions of them. We need a diverse amount of these critters. If we lack something, it will affect our health. It may be the most likely place to look for the source of the inflammatory activities found in fibromyalgia. About 73% of patients with fibro have reported gastrointestinal issues. 30 to 70% of patients with fibro have IBS, and 50% have chronic indigestion or dyspepsia. In fibromyalgia, anti-inflammatory and anti-nociceptive species in the gut were found to be depleted, and we need them. 2 bacterial species that influence cortisol were found to be more abundant in fibromyalgia. All of these correlate with our symptoms. And these species of bile-metabolizing gut bacteria and bile acids in the blood could be used as an effective biological signature to detect fibromyalgia. In a 2021 study, mice were injected with antibodies from immunoglobulins of people with fibro, and the mice quickly developed an increase in sensitivity to pressure and cold, and they showed a reduced movement grip strength. These were antibodies that are found in autoimmune conditions. When other mice were injected with healthy antibodies from immunoglobulins from people without fibromyalgia, the mice weren't affected. But when the infected mice had the autoantibodies removed from their system, the mice returned to their normal condition. The next step is for researchers to determine the factors that the symptom-inducing antibodies bind to. This could mean an autoimmune origin in fibromyalgia. It's already known that certain chemokines and cytokines were found irregular in the blood of those with fibro, so effective treatments are on the horizon. Learned that unusually high autoantibodies were found in people with fibromyalgia, such as serotonin at 73 to 74%, hormones such as those found in Hashimoto's, cortisol, progesterone, testosterone, and estrogen. And 74% of people with fibromyalgia have antibodies that go against gangliosides that are supposed to protect us against immune attacks. Phospholipids are there to provide protective barriers around cells. 55% of people with fibro have autoantibodies in their smooth muscles, and 40% have autoantibodies in their striated muscles. 32% have autoantibodies in their moisture-producing glands. This information is definitely telling us something. Long COVID has led to many individuals getting fibromyalgia. They also experience neuropathic pain. The triggering of fibromyalgia may have been due to damage of the neuromuscular immune dysfunction and upregulation of inflammatory cytokines such as IL-6 and IL-1. The neuroinflammation in fibromyalgia is similar to the neuroinflammation found in COVID. The possible autoimmune origin in fibromyalgia is similar to the pathogenic mechanisms in COVID. But they are two distinct diseases. Our autonomic system plays a huge role in how our body reacts to many functions: our heart and respiratory rate, digestion, urination, pupillary response, and sexual arousal are all part of our autonomic system. Our fight or flight response and the illnesses that come with autonomic issues, like those found in dysautonomia, are prevalent in fibromyalgia. I also want to acknowledge how important diet is and how it plays a part in fibromyalgia. Because of the many overlapping conditions found in fibromyalgia, we have to be aware that diets can vary among us. If you have prediabetes or diabetes, then carbs and sugar must be monitored or diminished to some extent. If you have Hashimoto's, lupus, or RA, or some other autoimmune disease, then you will need to monitor your intake of foods that are considered inflammatory. If you have GERD, then spicy foods and alcohol should be avoided. It's about doing the right things for your body. To finish this video, I brought attention to bursitis, feet and ankle issues, fibrofog, diabetes, mental health, hypermobility, low back pain, adrenal fatigue, chronic fatigue syndrome or ME/CFS, low body temperature, stress, the stages of fibromyalgia, potential blood tests, fMRI and detection of fibro, pacing and experiencing no guilt, taking control of our illness, and many others were discussed this past year. So I believe that 2023 will bring even more enlightenment to our journey of discovering more about fibromyalgia. And if you are yet to subscribe, I hope you'll do so. Be a part of our family here on YouTube, where we're learning and growing together. And if you like this video, remember to do that as well. I really appreciate it. I'd love to see this channel grow. I send you gentle hugs and support. Love you.